Hello. Today we're going to talk about heat illnesses. When temperatures rise, there are 4 heat illnesses coaches should be concerned about for their athletes: heat cramps, heat syncope, heat exhaustion, and heat stroke. We will discuss all 4 to understand recognition and treatment from the coach's perspective. Heat cramps are presented as severe, sometimes disabling cramps that typically begin in hands, calves, or feet. The muscles will be hard and tense with noticeable contractions. A coach must remove the athlete from play, provide fluids, and stretch or massage the muscle.
If an athlete is continually cramping, remove them for the rest of the day so they can be properly rehydrated.
Heat syncope occurs when someone faints while out in the heat. This is due to inadequate blood flow to the brain. A coach should remove the athlete from play and move them to a cool, shaded area, monitor vital signs, provide fluids, and have them examined by a medical professional. Heat exhaustion and heat stroke are more life-threatening conditions and need immediate treatment. Heat exhaustion is a sign of systemic vascular strain in the body in an attempt to maintain normal temperature. Signs and symptoms of heat exhaustion are fatigue, nausea, headaches, weakness, confusion, dizziness, fainting, drenching sweat with cold, clammy skin, and a slow or weakened heartbeat. A coach can treat an athlete with these symptoms by quickly removing them from activity, placing them in shaded or cool areas, elevating legs, giving fluids, and cooling with ice bags or towels in the armpits and groin. EMS should be activated if the athlete's condition is not improving quickly. Heat stroke is the most serious of the heat illnesses. It is a medical emergency and action must be taken immediately. It occurs when the body advances past heat exhaustion and the body temperature continues to rise. The athlete will present with the same as heat exhaustion, except they will have stopped sweating, have hot, dry, flushed skin, body temperature over 104 degrees, and a rapid heart rate. After activating EMS, coaches should work to cool the athlete by removing clothing, immersing the athlete in a cold tub or ice bags or towels, and monitoring vital signs until EMS arrives. Prevention for heat illness is key. OHSAA has a heat policy requiring measuring heat and humidity 30 minutes prior to any activity, as well as continually monitoring heat and humidity throughout the activity. Heat conditions and activity modifications are as follows. Heat index under 95 degrees. 1. Optional water breaks every 30 minutes for 10 minutes in duration to allow hydration as a group. 2. Have towels with ice for cooling of athletes as needed. Heat index of 95 degrees to 99 degrees. 1. Water shall always be available and athletes shall be able to take in as much water as they desire. 2. Mandatory water breaks every 30 minutes for 10 minutes in duration to allow for hydration as a group. 3. Have towels with ice for cooling of athletes as needed. 4. Helmets and other equipment should be removed when athletes are not directly involved with competition, drill, or practice, and it is not otherwise required by rule. 5. Reduce time of outside activity. Consider postponing practice to later in the day. Heat index of 100 degrees to 104 degrees. 1. Continue protocols from below 100 degrees. 2. Alter uniform by removing items if possible and permissible by rules. 3. Allow athletes to change to dry shirts and shorts at defined intervals. 4. Reduce time of outside activity as well as indoor activity if air conditioning is unavailable. 5. Postpone practice till later in the day. 6. If helmets or other protective requirements are required to be worn by rule or normal practice, suspend practice or competition immediately. Heat index above 104 degrees. 1. Suspend all outdoor activity.
Next, we will consider cold weather injuries. Though not as common as heat illnesses, coaches should be aware of 2 different types of cold injuries. Frostbite is the freezing of any part of the body. Here, ice crystals form within or between the cells. Red blood cells and platelets clump and restrict blood flow, especially in the ears, fingers, toes, and nose. These areas are usually the first affected and may turn cold, white, hard, and numb. Frostbite can be deceptive. While the first symptom is a sensation of pins and needles, frostbite progresses to numbness. And because it causes numbness rather than pain, individuals affected may not be aware it is happening in time to prevent serious damage. Frostbitten skin is hard, pale, cold, and has no feeling. Hypothermia is the lowering of the body temperature below 95 degrees. This results from prolonged exposure to cold when the body's heat loss is greater than its heat production. Hypothermia can be life-threatening, and as in the case of frostbite, the sooner the affected person receives treatment, the better the chances for survival and recovery. Hypothermia symptoms include uncontrollable shivering, although at extremely low body temperatures, shivering may stop, weakness and loss of coordination, confusion, pale and cold skin, drowsiness, and slowed breathing or heart rate. Mild hypothermia is reversed with passive rewarming by removing wet clothing and moving the athlete to a warm room where dry clothing or blanket should be applied. Moderate hypothermia is often treated first with active external rewarming and then with passive rewarming. Active external rewarming involves applying heat to the skin. Severe hypothermia requires active internal rewarming.